Good afternoon, everyone, and welcome to the first of a new weekly COVID panel discussion with key community leaders who you see in front of you right now. And it's a fine collection of leaders who are doing their best to help us through these unprecedented times. And speaking of unprecedented, this is an unprecedented collaboration between our two local hospitals, Tallahassee Memorial Healthcare and Capital Regional Medical Center, coming together to get information out during this pandemic. We're also joined by representatives from the city of Tallahassee, Leon County, the Leon County Health Department, Bond Community Health Center, and Neighborhood Medical Center, folks that are coming together to try to get you the best information that they can. I would also like to recognize our partner, the Village Square, which continues its amazing mission of promoting civil discussion and discourse in our community. My name is Skip Foster. I'm the former publisher of the Tallahassee Democrat, current marketing consultant, and today's moderator. The good news is that you have submitted a ton of questions. The only bad news is that our time is limited, so I've asked our panelists to make their answers brief but densely packed with information. So let's get started, and I would first like to welcome the Mayor of Tallahassee, John Dailey, for some opening remarks. He's going to hand it off to Leon County Commission Chairman Rick Miner and Kevin Peters, who's the Director of Emergency Management in the county. Mr. Mayor, thanks for being here and for kicking us off.
Skip, thank you, and I appreciate you moderating. I want to thank TMH for hosting this new weekly conversation that we will have. We've got a lot of great people that are on that are doing the good hard work here in our community. I want to thank Trey and Dean for everything that y'all are doing at your respective organizations to help keep our community safe. Obviously, the health department, Bond, neighborhood, everybody has a role to play. It's good to see my good friend, the chairman, Rick Miner, who I know will follow with some comments as well. And of course, Kevin Peters over at Emergency Management. And I also want to thank the Village Square for co-hosting. You know, these are unprecedented times. These are difficult times. While we are working very hard and we are very blessed to have a community that works very well together in all different capacities, and we all have our role to play, we do recognize that there is a lot of work to be done. And while some of the trends that we see are good, I am concerned about some of the trends that we are seeing as well. I am encouraged by the president's comments the other night to put together a national plan. I am encouraged by the president's comments the other night with the goal of vaccinating 100 million Americans in 100 days. And I look forward to us playing a significant role, obviously, here in our community, following the leadership of the health department. Now, I will tell you, and I look forward to hearing as well as our strategy talk, one of the concerning trends in our community that I do want to put out there is the fact that we have had 22,000 vaccinations in our community, yet we've only had 1,800 vaccinations in the African-American community. And we know that the global pandemic has hit the African-American community disproportionately nationwide and in our community, both from a health perspective and an economic perspective. And when 1/3 of our community is African-American, yet only 8% of those that have received the vaccination are African-American, I think that is an issue that we need to pay attention to. It's unacceptable, and we have to concentrate on vaccination equity as well in our community. Having said that, I know our good friend and colleague, Representative Ramon Alexander, has called for a massive vaccination site, possibly at FAMU. I love the creative ideas that are coming out of this community. I'm confident that we'll be able to work together to move forward. And I'm going to do everything I can as mayor as well. With that, let me go ahead and turn it over to Chairman Miner as well for opening comments. Thanks for having me, Skip.
Thank you, Mayor Dailey. Good afternoon, everyone. I'm very pleased to represent Leon County government on today's COVID-19 update. I want to begin by recognizing the hard work and leadership of the healthcare experts at this virtual meeting, my colleagues here at the county, the mayor, John Dailey, and everyone at the city of Tallahassee, and all the staff who have worked nonstop to keep our community as safe as possible since the start of the pandemic nearly 1 year ago. Thanks also to TMH and Capital Regional Medical Center, as well as Bond Community Health Center, Neighborhood Medical Health Center, and the North Monroe Medical Centers, who have worked tirelessly over the last several months, serving and protecting our vulnerable and hard to reach populations and ensuring that they have the same access to vaccines as everyone else. Mayor Dailey touched on that, and I think we'll be dealing with that during the call and going forward. I'd also like to thank our scores of volunteers who have stepped in to assist the state's clinics with traffic management, distributing and collecting vaccination forms, sanitizing equipment, and my wife, for example, has been performing data entry with a lot of other volunteers. 317 days ago today, by request of the Florida Department of Health, Leon County government activated the Emergency Operations Center to coordinate public health efforts across every discipline, from building healthcare, surge capacity to planning, vaccine distribution, and more. Since March, the county has distributed more than 500,000 face masks to local businesses and county residents. Through local healthcare providers and FQHCs, continue to process more than 2,500 COVID-19 tests each day. That's a level 15 times greater than the state's recommended daily average. Testing will remain critical going forward, even during vaccine distribution. As you all know, we've experienced tremendous loss and difficulty since the beginning of the COVID-19 pandemic. And although with vaccine breakthroughs, we can begin to see a light at the end of the tunnel, unfortunately, we're not at the other side of it yet. Even as our greatest challenges still lie ahead, as a community, we must continue to work together to keep ourselves, our neighbors, and our families safe by wearing a mask, by keeping a distance, that 1 alligator distance from each other, washing hands frequently for 20 seconds, and receiving a vaccine when able. Now, the Florida Department of Health in Leon County is administering our community's vaccine distribution. But your county government has been working very hard with partners to provide them with support in a multitude of ways. I'd like to introduce Kevin Peters, who is Leon County's Emergency Management Director. He's had a key role in coordinating with the Florida Department of Health in Leon County so that Leon County government is doing everything it can to help deliver shots into people's arms. Kevin, will you take it from here?
Yes, sir. Thank you, Mr. Chairman, and good afternoon, everyone. Thank you for having me here today. Over the last 317 days of an Emergency Operations Center activation, Leon County has been very engaged in supporting our partners at the Florida Department of Health in Leon County. We've done this through ongoing local, state, and federal coordination. This equates to over 775 different conference calls between our local healthcare partners, many of which I talked to that are on this call, Dr. Robinson, Dr. Blake, Dr. Watson, Ms. Freeman, and Ms. Blackburn on nearly a weekly basis, if not multiple times per week. We've engaged 14,000 different partners through these conference calls that we've been conducting and participating on since March. Directly and most recently, we're supporting Claudia Blackburn's operation with scheduling of vaccines through the use of our mass notification system. It's powered by the Everbridge platform. It allows us to coordinate directly with the Department of Health for those that have registered for vaccines through their portal to help with some of the scheduling, in addition to the support that we're providing through Volunteer Leon with call center support. We're able to use that messaging platform to directly contact the people that have registered. Our Leon County paramedics are also engaged in the vaccination process directly, working at the vaccine site with Ms. Blackburn's health department team. We have paramedics that have been assisting since December 24th at the scheduled clinics, providing both first and second dose vaccine shots to our citizens of Leon County. Our public works staff has also provided on-site support at these vaccine clinics with the setup and breakdown and traffic direction and signage for the traffic flow that comes through these drive-through sites. Our sheriff's office, under the direction of Sheriff McNeil, has been able to provide assistance with traffic coordination and calming in the area around the county's health department building where our vaccine process occurs, to ensure we have maintain a safe environment for those that are queued up in the traffic line that comes into the health department to receive their vaccine. Through our volunteer center, Volunteer Leon has recruited and vetted volunteers to assist both on-site at the vaccine clinic, as well to assist Claudia Blackburn's team with calling individuals to schedule appointments for vaccine clinic. Our community and media relations team has been sharing approved and vetted information about the DOH clinics through all of our platforms to reach hundreds of thousands of citizens over the last few weeks. And additionally, through our Human Services and Community Partnerships program, in assistance with the Department of Health, we brought together our local nonprofit partners and agencies to discuss the vaccinations and the role human services agencies can play in communicating and assisting their clients with obtaining the vaccination. I know we're on a tight time frame, and that was a lot of information, but I think, Skip, we're meeting that content request, a lot of information in a short amount of time. But thank you for the opportunity to share that information.
Thank you, Kevin. Dense is the word of the day, which, you know, my wife uses on me a lot, but we're talking about it in a different context here. So I'm going to be introducing folks as we go along rather than doing that at the top. So we're going to get to everybody. I've got everybody in order here. And first, I want to introduce Claudia Blackburn, who is the Health Officer for the Leon County Department of Health. And Ms. Blackburn, I just was hoping you could give us an overview of what you're seeing with some of the key metrics that I know you track, positivity rate and things like that. Just give a folks understanding of kind of where are we and what are the trends.
Sure, thank you for that question. So we've had 23,949 cases in Leon County residents to date, and 206 tragic deaths. Our positivity rate for the last 2 weeks has been 7.86%. And so far for this week, which we consider to be week 3, is, and that's January 17th through the 23rd, our rate has increased to 8.8%. So it's not continuing to go down as we would like it to be. And we have had 208 cases per day for the last week. And that's a lot of cases for us to investigate and do contact tracing on. So we've seen a surge after every holiday, but nothing like we've seen after this holiday. This one has been the highest to date. And we really need people to wear their masks, as Commissioner Minor said, to socially distance, use hand hygiene, and continue to be vigilant.
That's great. And I want to just follow up because by far the highest volume of questions we've received in advance of this has been about the supply of vaccines. And I think those are kind of broken into two categories. One is, when am I going to get my first one? And even more than that has been folks that are concerned about getting the second shot. In fact, recently elected Representative Tant has just sent us in a question about folks that are frustrated that they can't get their call answered on when to get that second one scheduled. So can you just address that for Representative Tant and the community at large?
Sure. Well, let me try to answer both of those. So the vaccine rollout began around December 26th in Leon County. And we have had a limited supply of vaccine. The demand certainly outstrips the supply. We have received about 12,835 doses of Pfizer, 12,400 doses of Moderna, for a total of 25,235 doses. And this includes first and second doses. We have transferred out over 14,000 doses to our healthcare partners to vaccinate healthcare workers and their population of people 65 and over. So all that said, we have immunized 39% of the people that are 65 and over in Leon County. We look at about 41,000 in that category. So we're doing pretty good. And that's all the partners combined. That's people, Leon residents, whether they got vaccinated here or in another county. Now, if they got vaccinated out of state, we don't know about it. In terms of the second dose, we have been receiving the booster doses, and we have 8 clinics on the books to give people their second doses. The schedule is published on our website, and we did have to move people. So giving websites online is difficult, but it's leon.floridahealth.gov. And on our website is the schedule for the booster doses. We did have to move some people from January 30th who were originally scheduled January 30th to February 2nd. And that is all there on the website. So if you got Moderna and you were originally scheduled for January 30th, you have been moved to February the 2nd. And so please refer to that. Thus far, we have immunized 22,659 people in Leon County. So that's pretty good. And that's because of the tremendous partnerships that are reflected here and others that aren't even on this call. So does that answer your question?
Last question before I move on to other panelists. Can you say with confidence, I mean, is there any doubt that if you got the first shot, you're going to get the second one in a timely manner, in a manner that will make it be effective? Are you confident that we've got enough of those to cover the folks that have already been vaccinated?
They have been rolling in as scheduled. I mean, we don't have all of them yet because we wouldn't have all of them yet,
right.
But so far they've come in as promised. And, you know, I'm a bird in the hand kind of person. I have every indication to believe that they will continue to come as promised.
Great. Okay, I want to bring some of our other folks in here. Thank you, Ms. Blackburn. We also have with us Dr. Jeanne Watson, who's the Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan, as well as Dr. Trey Blake, Chief Medical Officer at Capital Regional Medical Center. Doctors Watson and Blake, same question to you. Can you give us just an overview of what you are tracking at your respective hospitals? Dr. Watson, I see you off mute, so why don't you lead us off?
Happy to do it. Good afternoon. Same kind of thing that Claudia was mentioning. We're watching the hospitalizations, obviously, because we're actively involved in that. Mortality rates, obviously, percent positive trend. We monitor that. And importantly, what Claudia was pointing out, we watch the vaccination rates and the demographics. I'm just going to jump into this real quick and then let Trey jump in. TMH partnered with Claudia and her team early, actually on day one when the vaccines arrived, and delivered out to the community and to all of the community partners on day one, actually within 2 hours of receipt of vaccine. So I'll just tell you, looking at everybody on this call, it's just a great team. And the hospitals partnering, and fun part about it is most of these we're all friends, which makes it even easier. And we know when there are needs that we can reach out to each other. So it really has been a great process. We made sure everybody was involved from the first day. And to this day, last thing I'll say is we've developed a distribution model, and Claudia has been actively involved in that, to make sure that we get vaccines out to patients rapidly. We have a deal that when we get those vaccines, they're out in arms in less than 7 days. Our goal is 5 days into the arms so that our cabinets are empty. And the last thing is that your question was about second doses. Claudia is not the only one handling second doses. So people are calling in, they're thinking, well, okay, Claudia's doing it. No, it's not. You can't burden Claudia with all second doses. The doctor's offices are also setting up second doses. You know, Ms. Freeman, Dr. Robinson, you know, Trey's group, we're all doing this together, setting up second doses. So it's not really just all Claudia's burden. She's doing the best she can and doing a great job getting vaccine out, but it's really our responsibility as a community to make sure that our patients are aware of when to get their second dose. And I'll tell you, what a great team on this call.
Thank you, Dr. Watson. Dr. Blake, I wonder if you could also address the hospitalization trend. I've noticed it looks like we may have peaked on statewide hospitalizations. That's been trending down for about a week, maybe a little more. Are you seeing that locally? And have we kind of traditionally during this pandemic been ahead or behind on the hospitalization curve?
Yeah, thank you. We are seeing our hospitalizations trend down, which is good news. We peaked last week with 87 hospitalizations, and we're now down into the low 70s, and that trend seems to be continuing. So that is good news. We're continuing to watch closely ICU capacity, ventilator capacity. We also watch staffing very closely, and all of those numbers are also slightly improving. We're not out of the woods yet, but we're hopeful that this trend continues and that we're heading in the right direction. And I will also echo what Dean said. This challenge has been an opportunity to make new friendships and work together, which I also very much value everyone here today. So thank you.
Thank you, Dr. Blake, and we'll come back to you shortly. Finally, I want to bring in Dr. Temple Robinson, Chief Executive Officer at Bond Community Health Center, and Jeanne Freeman, who is the CEO at the Neighborhood Medical Center. Dr. Robinson and Ms. Freeman, how does what you're experiencing really at the ground level at your health centers differ from what is happening at the hospitals, if at all? Why don't you start us off, Dr. Robinson?
Well, first, quickly, I do want to thank TMH and the Leon County Health Department. They were able to get vaccine to us as soon as they got unpacked in Tallahassee, as we waited for our allotment to come from the Department of Health, which was a little while thereafter. I think as of today, we have probably seen about as many of the first takers in the first round. So we sent out several campaigns to our 65-year-old patients and older, 2 or 3 campaigns. And I would say maybe half of our patients have taken the vaccine. And the rest, I think, are in that let's wait and see how the community fares before they come. We've vaccinated our staff so far. And so now our efforts will be to double down on those who did not take the vaccine on the first go round to see if we can convince those reluctant people to come in.
And we're definitely catching the people that are not in the hospitals on a daily basis. There are many community members who are in the neighborhoods where our clinics are located, and we're catching those people. The key to being able to service those people is providing education. So we're fielding questions from the community on a daily basis, and we're getting a lot of questions about information about the vaccine.
That's great. Ms. Freeman, while I've got you, and since the mayor brought it up in his opening comments, and I know you and I discussed this question just before we got started, I wanted to ask you about the percentage of African Americans who have received the vaccine in Leon County. It's roughly 1,800 of roughly 21,000, about 8%, while African Americans make up about almost 4 times that percentage of our population. Why is that percentage low? What can you tell us about that?
Well, just from what we're seeing, there's a hesitancy amongst minorities getting the COVID vaccine. And we understand that. I think we need to put that focus on educating our community about, what's best for us as we move forward through this pandemic. There's a distrust or mistrust of some types of authority at times. So it's really about refocusing that energy on educating our population. I mean, right now, 65% of who we vaccinate have been minorities. So that's definitely some progress.
Thank you. That's great. I appreciate that. Okay, Ms. Blackburn, I want to come back to you. And we've just had a question come in from folks that are having trouble finding the schedule that you referenced. So we need to figure out a way to get them that link so that they can find it. Maybe we can, Danielle, I know you're listening. Maybe there's a way to just share that in the chat. So we'll get that addressed. And then I wanted to, a question has come in that mirrors a question from the community. And by the way, we're kind of transitioning now to the community question part. And that is that there's still seniors that haven't gotten their first shot that aren't sure what they're supposed to do. Who should they be reaching out to make sure they get to get their first vaccination ASAP? Is there a waiting list? And there's also a question here about people's, let me find this, the suspension of applications. There's a question about that and when that will start. So I know I bundled a lot in there, but thank you for bearing with me.
So, and we appreciate everybody's patience on this. So we originally posted an online request for vaccination form on our website, again at leon.floridahealth.gov, and over 16,000 people registered. And we have been working through that list, removing people from that list if they've been vaccinated elsewhere in the community. And we are down to about 8,100 people. So we have made progress. We'll be doing about 1,000 for our next clinic that's coming up. And we did close the online registration because our system right now is cumbersome and we're getting a new scheduling system from the state. And we will reopen the appointments when we work through this list and with that new scheduling system. So that's kind of where we are. There are, some people can get it through their physicians. FSU has been immunizing people. FAMU's immunizing people that are associated with their population. So there have been, bonded neighborhood, there are other avenues, but not a lot. So we're just asking people to be patient as we work through that list. I hope that answers.
Can I clarify something real quick on that? Because I want to make sure we have a lot of people watching probably that have physicians in different practices. Just Claudia, and correct me, but a lot of the limitations, as Claudia mentioned, are based on lack of vaccine availability. We have a distribution model that can vaccinate thousands and thousands and thousands a week. And you're looking at a lot of the members on this call that are part of that distribution model. So if you have a primary care, or you're involved with bond, or you're involved with a neighborhood medical center, that's who you're communicating with your primary, because they do have lists. And whenever Claudia gets those vaccines to us, they are in your arms rapid fashion. But we have our offices calling every patient that's 65 and over, getting them ready for vaccines. So I just want to reiterate, it's not just all on Claudia's shoulders. This is a community-wide effort, and we're just depending on Claudia right now for vaccine. And it's not her, she just is funneling them to us. This is a federal issue, not a state and not a Claudia issue.
Thank you for clarifying that. And I wonder, do the doctor's offices the primary care physicians are facilitating the vaccine, but that doesn't mean they're actually administering it, right? I mean, there's cold storage requirements there.
No, they're administering it. TMH is partnered with every single practice that we've reached out to, every single practice in the community, those that are interested in delivering the vaccine. We have a whole system designed for them. If it's the Pfizer and we know they need it within 5 days, we can dispense. If it's longer than 5 days, we hold on to it, but we know when they need it, we're going to get it to them. And so that's that distribution model. But again, it's back to the point that there is no vaccine. The distribution model is just something to talk about.
And Ms. Blackburn, I know you're a bird in the hand kind of woman, as you've said, but do you have any kind of rough estimate on when the new software will be in, the new system, I guess I should say, and when you'll be reopening the applications? Is that days or weeks?
Two different things. We're going to be getting that new system in the next week or two, but that doesn't, we're all waiting for a vaccine to work through that list. But we may be using that new system to help schedule people that are on the current list. And I just want to underscore what Dr. Watson is saying. We are transferring vaccine. As I said in the beginning, we've transferred out thousands of doses to TMH, who then transfers it to physicians. But we're also we're asking people not to call their doctors, because the doctors have a list and the doctors are calling them. Is that right, Dr. Watson? We don't want to shut down any more phone systems.
Yeah, that's absolutely correct. So what all the practices are doing is looking at the highest risk populations first and then working their way down. That's exactly right.
Okay. So if I'm a 75-year-old and I've yet to get a dose and I'm not on a waiting list, I need to just hang tight right now, or is there something specifically I should be doing?
No, I'm not opposed to proactive activities, but back to Claudia's point is that, I mean, if you have a scheduled appointment with your doctor anyway, communicate that. But the doctors, like I'm saying, they're actively looking at their list right now, reaching out. And why you probably haven't heard from them yet is because, back to Claudia's point, no vaccine. We don't really want to schedule people and let them down. So unfortunately, what you're hearing is scheduling weekly. Claudia does a great job trying to get as much vaccine as she can, and then we all communicate after we know what her needs are and then what we can deliver to the community. So it's unfortunately, like Claudia said, patience is a virtue, and let me tell you, 39% of 65 and over, that is incredible. That's a great team. I just can't say that enough.
So just to kind of get us out of this, because I don't want us to, there's other topics I want to talk about, but we don't have any bottleneck issues locally. When we get vaccine, we're able to almost immediately administer it. There is confidence that we're going to have as many second shots as we have had first ones. And it's just a matter of when can it come in. The website, we've had two or three people, Ms. Blackburn, say that the website has dates, not times. So I guess the times come when it gets closer to the date. Is that fair?
Yes, we will be sending out alerts. And so people just need to pay attention and answer their phone. They'll get an alert that tells them the time.
Okay. Okay, so I want to shift to a kind of a separate question, which is for you, Dr. Blake, and that is, what are we seeing in terms of side effects, and what can you tell people, side effects of the vaccine? What should people expect when they get it, or at least be prepared for? And also, there's a number of questions about how to get, how and when the other vaccines that we get, flu shots, shingles, et cetera, how those should work in tandem. Can you take both of those, please?
Yeah, the first question, there's a large percentage of people that have soreness at the site of the injection and feel tired for the next 24 hours. The second dose of the vaccine, unfortunately, has more symptoms, and there's a large percentage of people that have headache, chills, body aches, tiredness, and even a low-grade fever. So people should expect when you're getting that second dose of vaccine that you're going to feel a little under the weather for the next 24 hours. And usually those side effects start about 12 hours after the shot. That is not a reason not to take the vaccine. You can treat those symptoms with Tylenol, NSAIDs, drink fluids, rest. We advise people, if you're taking the second dose of the vaccine, do not plan on traveling or doing something the next day. Just plan on taking it easy the next day. In terms of the other vaccines, we tell people to try to avoid getting them together. You really shouldn't. We do not take the flu vaccine and the COVID vaccine at the same time. So we tell people to avoid those. So people should expect some symptoms, but still plan on getting the second dose of the vaccine.
But you do want people to get the flu vaccine eventually, although I know we're getting late in the season. So what is it, 2 weeks, 4 weeks, 8 weeks? How long, what gap should there be between those?
We advise people at least 4 weeks, but you're absolutely correct. People should still get all of their vaccines. Okay,
great. Dr. Robinson, we had a question about underlying health issues and how kind of the process for having those evaluated as folks can, determine whether they should get the vaccine or not. How does that work at Bond and elsewhere?
Well, what we're doing, we're following Secretary Rifke's directives, which include vaccinating vulnerable populations and high-risk patients. So our providers, especially those that are affiliated with a hospital, we look at our medical record list and we identify those patients that have underlying health issues, and we bring them in to get them vaccinated. We're also, all of us are charged not to waste one dose of vaccine. So if we start in the morning with an open vial and it's about 4 o'clock in the afternoon and we still have 1 or 2 doses, we're scurrying around. We keep a waiting list on one side, but we will scurry around in the neighborhood, the offices that are near our offices, the churches that are near our offices, picking up the phone saying, hey, I've got a dose. Are you over 65? Do you want to come over and get vaccinated? We try to tailor our services to our own patients, but we also know that we're here to help Leon County. So if we can find somebody that wants a dose and we've got one left, we're jugging them.
Are you, so maybe people should just be hanging around outside I'm kidding.
No,
I'm kidding.
We don't want to do that, but we are being very frugal and very protective of the doses. We have not wasted one dose of vaccine at Bond.
That's great. That's great to hear. Dr. Watson, 95% effective. What does that mean, and how does understanding how these vaccines work help us understand that statistic? That was a question from a community member.
The original question was, what is a vaccine, right? So delivering anything into your body that causes your body to generate antibodies, right? So we're delivering, there are various types of vaccines, but This specific vaccine that we're using right now causes your body to actually create a protein that then generates an antibody response. So it's absolutely fascinating how it works. And when they looked at the studies, they're going to say, well, how do I know that somebody is immune? Well, they're looking at antibody production. They're looking at levels of antibodies to determine, hey, how much would I need to make sure that if I was exposed, that I would not become infected, that I would be immune to that infection. And that's what they looked at. They looked and said, hey, with the current doses at the current separation of 4 weeks or 3 weeks, depending on what vaccine you're getting, that you produced enough antibodies to be immune. So they found 95 or 94.5% with Moderna of the patients that received the vaccine had enough antibody production that they would be considered immune. Now, on top of that, let me just say that just because you don't have that level of antibody does not mean that the vaccine's not going to be beneficial for you. You may still be able to produce antibodies so that your infection would be less damaging to your body because you receive the vaccine. That's why it's so important to receive the vaccine. And back to the point, last thing I'll say is wearing a mask, washing your hands, social distancing, that doesn't mean you don't have to do those anymore. I hear people say, well, I got my vaccine, I'm throwing my mask. No, not until we have enough people vaccinated to show that we have the response we want, the reduction and all the things we've talked about, all the things we're tracking. You still need to wear your mask, wash your hands, and social distance.
Okay, the last thing I want to ask about, and I'm going to put this open to the floor so y'all don't leave me hanging, and that is we had a lot of questions about people wanting an update on the school situation and what we've learned about school spread and where teachers kind of fit in the vaccination line. Who can give us an update on the impact of COVID in the schools and then hence in our community? I see smiling like, yeah, I'm not taking that one. So somebody's got to step up for me here.
I can talk about that a little bit because we work with the schools and we do the contact investigation in the schools when there's a case. And I can tell you that, and I can't give you the numbers right now, but I can tell you that the spread that you see around school cases does not happen in the schools. It's happening outside of school, usually in some kind of social or sport environment. And so the schools are actually doing a really great job of preventing spread of COVID. As far as the teachers go, we have vaccinated people that work for Leon County schools that are 65 and over, and also the healthcare workers within the schools.
Anybody want to add anything to that? That's a great answer. Thank you, Ms. Blackburn. Okay, so we're going to do these weekly, and so we want to keep them to, our target was a half an hour. We've gone a little bit over there, but it was hard because the questions poured in. We appreciate that. If you didn't get your question answered, we're going to do this every Friday, same bat time, same bat channel. We might rotate some of these folks, but we're going to get you the best information we can. So I thank you for your time. I'm going to give, sorry.
I want to do one thing before, because this is really important, and I apologize for interrupting you. There's no better way to give back than through research, okay? So that if you are someone that has been infected in the last 14 days in this area, and you are interested in joining in on research, because we'll never improve without looking at ways to improve treatments. There are plenty of research projects. I know Bond's involved in research. I know, and I'm sure Neighborhood Medical is going to be getting involved. I'm telling you, everybody's involved in this. So if you have interest, you're between the ages of 40 and 80, and you have interest in involvement, looking at clotting factors, looking at reducing that chances of having a stroke or having another event, just email covidresearch@tmh.org and we'll get you involved. covidresearch@tmh.org. And again, we're all working as a team on this, but that's the central place. And I'm sorry for interrupting you, Skip.
No, don't apologize. That's great information and a great way to contribute to humankind. So thank you for offering that. Okay, Chairman Minor, if you would make just a couple closing remarks and then hand it to Mayor Dailey, and then we'll get wrapped up.
Thank you very much, Skip. I'm gonna put my closing remarks to the side and ask a question that Representative Tant has said a lot of people have had some anxiety about. People are nervous about Everbridge. Do they need to register with it or do they need to opt in somehow? How exactly is that process going to work?
Thank you, Mr. Chairman. With respect to Everbridge, the way that we are using it, if they are on Claudia's list, if they had registered through the initial portal.
Kevin, I'm sorry to interrupt. Can you just briefly tell folks what Everbridge is that might not know?
Okay. Yeah. So Everbridge it's a mass notification system. Some people may have heard in the past systems are referred to as reverse 911 type systems. It's a tool that the county has that we can send hazardous weather updates or emergency information updates to the people that have registered to receive alerts from Leon County Emergency Management. In this instance, though, the way we're using it, you do not have to be part of the system. We are importing the phone numbers of the individuals that registered through the initial health department portal. It's an export of the phone numbers. So whatever phone number you provided to the health department is going to be provided to emergency management, and we're going to push the message to those phone numbers. There's no action that anybody needs to take to receive this notification. I would say, though, as emergency management, though, if you would like to receive emergency notifications from Leon County government, you can register to receive those through the Everbridge system. And I don't want to mix messages here, but visit the county's emergency management website at leoncountyfl.gov if you're interested in registering. But on this point specifically, there's no action anybody needs to take. We will send the message to you based on what you submitted when you initially registered.
Kevin, just one thing on that. Aren't they supposed to press 1 or 2 or reply in some way to confirm that they received the message?
Right. Now, there will be within the message, embedded in the message, there is the opportunity to reply to acknowledge receipt of the message. That will help with the planning for the clinics that Claudia does. And there can be some follow-up if need be to contact individuals that may not respond at all. So it gives us some opportunity to do some additional outreach. But yes, it will go through a text message that there's an option to reply. Also, there will be, if it hits your voicemail, there will be an automated voice with a number that you can call back to acknowledge receipt of the message.
So
Dr. Robinson, I'm sorry. Go ahead, Dr. Blackburn.
Underscore the need to confirm that you received the message and that you're going to come for your appointment, because if you don't, then we need to call you, and that's just thousands of calls. So we're using this so that we don't have to make as many calls, so people could confirm that they got the message and that they'll be coming. That's what we're looking for.
And I will say real quick before we go to Dr. Robinson, we've used this to notify for some appointments already, and it's been very successful. It's not complicated at all.
And quickly, I just wanted to reassure people, when Dr. Watson speaks of research, a lot of people are nervous thinking that we're going to use some type of experimental drug on you or something. We're not. This is not what we're doing. We're trying to prevent people who are COVID positive from having clots, from having strokes, from having what we call pulmonary embolus, when you have a clot in your leg and it goes to the lung. So we're talking about things like aspirin and placebo, medicines like Eliquis have been on the market a long time. So I want people to really, really be comfortable in enrolling in these studies. We're not trying some new drug on you. So I just wanted to put that out there.
That's very helpful. Thank you very much. And thank you, Chairman Minor, for passing that question along. Mayor Dailey, some closing comments?
Thank you. I appreciate it. First of all, just a quick question. Skip, there's still a lot of unanswered questions, which is great. That is drawing a lot of attention, this forum. I am assuming that all those questions will be answered and posted even after this particular virtual session. Do you have any information on that?
We've been chatting about that as the thing has gone on, and as I've tried to do my job, we will figure that out. Obviously, new questions will crop up as well, but I'm going to work and try to figure that out.
Excellent. Well, first of all, I want to thank all the professionals here. Dean, I think you were the one, also stressed by Trey. One of the amazing things about this community is that we are all friends. We all work very well together, even during these daunting times, and everybody plays a specific role. And I think that's what makes Tallahassee so wonderful. And I appreciate both your organizations and everything that you're doing. Our health clinics are second to none. Enjoy working with both you ladies, and thank you so much for everything. And Claudia, I know that you have a monumental task at the health department, and we appreciate your leadership efforts as well. My message is simple. Obviously, the city of Tallahassee will continue to stand ready to support each and every one of your organizations, as we are doing, not to go into the details, but we are here and we'll continue to support you. I do want to give a shout out to the Tallahassee Fire Department and all of the great men and women that have been participating in the vaccination process in the pipeline since day one. They are doing a tremendous job. I do want to ask the public to remember, please wear your masks, social distance. Let's follow the guidelines. We were one of the first communities in the state to really step up to the plate and show how to do it right. And we have to stay vigilant and we have to keep moving forward. And second of all, as we move forward working, I want to end with what I started with and remind us that we all have a challenge and we have to respect and we have to work very hard to make sure that we do have an equal distribution of the vaccination and that all areas of our population as represented in our community have equal access, and we need to push hard to give people the opportunity. I want to thank Skip, the Village Square, and TMH for hosting this and look forward to participating in future. Thanks, Skip.
Thank you, Mayor Dailey, and thank you to all of the panelists, especially TMH and CRMC coming together in unprecedented fashion, really, to help educate our folks on this. Community, as you look at this screen, a lot of folks working hard that care a lot and really want to do the best they can for you. I hope that shine through. We're going to answer all of your questions and we'll be here same time next week to get this done. So thanks everyone for your questions. Thanks panelists for your participation, and please be safe out there. Take care and have a good weekend.